8 warning signs that your health is in danger. As we grow older, it's natural for our bodies to change. However, some changes can be warning signs of serious health issues. Recognizing these symptoms early can help prevent complications and improve your quality of life. Here are 8 unusual symptoms that you should never ignore. 1. Sudden and unexplained. Weight loss. Losing weight without trying might sound like a dream come true, but it can be a serious warning sign. If you lose more than 10 pounds in a few months without a change in diet or exercise, it could indicate problems like 1. Diabetes. Your body might not be using sugar properly. 2. Thyroid problems. An overactive thyroid, hyperthyroidism, can speed up your metabolism. 3. Cancer. Some cancers cause rapid weight loss. 4. Digestive disorders. Conditions like celiac disease or Crohn's disease can prevent nutrient absorption. 5. Chronic infections. Diseases like tuberculosis or HIV can cause weight loss. What you can do. 1. Monitor your weight regularly and keep track of any changes. 2. Eat a balanced diet to ensure proper nutrition. 3. Schedule a checkup with your doctor if you notice unexplained weight loss. 2. Persistent fatigue or weakness. Feeling tired occasionally is normal, but constant fatigue that doesn't improve with rest can be a sign of 1. Anemia. A lack of red blood cells can make you feel weak and tired. 2. Heart disease. If your heart isn't pumping efficiently, your body may feel drained. 3. Sleep apnea. Poor sleep quality due to interrupted breathing can leave you exhausted. 4. Depression. Mental health can affect physical energy levels. 5. Chronic infections. Long-term illnesses can deplete your energy. What you can do. 1. Ensure you are getting enough sleep each night, 7 to 9 hours for adults. 2. Stay hydrated and eat a diet rich in iron and essential vitamins. 3. Seek medical advice if fatigue lasts for more than 2 weeks. 3. Shortness of breath. Struggling to catch your breath, especially during mild activities, might indicate 1. Heart disease. Blocked arteries can reduce oxygen flow to your heart and lungs. 2. Lung disease. Conditions like COPD or pneumonia can make breathing difficult. 3. Anxiety or panic attacks. Stress can sometimes cause breathing problems. 4. Asthma. Inflammation in the airways can restrict breathing. What you can do. 1. Avoid exposure to smoke and allergens. 2. Practice deep breathing exercises and relaxation techniques. 3. Visit a doctor if shortness of breath persists or worsens. 4. Changes in bowel habits. If you experience long-term constipation, diarrhea, or unusual stool colors, it could be due to 1. Colon cancer. Blood in the stool or persistent changes in bowel habits can be warning signs. 2. Irritable bowel syndrome, IBS, a common condition affecting digestion. 3. Food intolerances. Certain foods may cause digestive distress. 4. Diverticulitis. Inflammation of pouches in the intestines. What you can do. 1. Increase fiber intake and stay hydrated. 2. Keep a food diary to identify potential triggers. 3. Consult a doctor if changes last more than a few weeks. 5. Chest pain or discomfort. Not all chest pain is a heart attack, but any discomfort should be taken seriously. It might be caused by 1. Heart attack. Pain spreading to your arm, jaw or back can indicate a blockage. 2. Acid reflux, GERD. Stomach acid can cause chest discomfort. 3. Muscle strain. Sore chest muscles can mimic heart pain. 4. Pulmonary embolism. A blood clot in the lungs can cause sudden chest pain. What you can do. 1. Note the type and duration of chest pain. 2. Avoid heavy meals before bedtime to prevent reflux. 3. Seek emergency medical care for severe or unexplained chest pain. 6. Unexplained bruising or bleeding. Frequent bruising or bleeding without injury may point to 1. Blood disorders. Conditions like leukemia or clotting issues can cause bruising. 2. Liver disease. A damaged liver affects blood clotting. 3. Medication side effects. Blood thinners can make bruising easier. 4. Vitamin deficiencies. A lack of vitamin C or K can lead to easy bruising. What you can do. 1. Take note of how and when bruises appear. 2. Eat a diet rich in vitamins and minerals. 3. Consult a doctor if bruising occurs frequently or without a clear cause. 7. Persistent headaches or dizziness. Occasional headaches are common, but if you have frequent severe headaches or dizziness, it could indicate 1. High blood pressure. Uncontrolled hypertension can cause headaches. 2. Stroke. Sudden headaches with vision problems, numbness or confusion require immediate attention. 3. Inner ear problems. Issues with balance can cause dizziness. 4. Migraines, severe headaches accompanied by nausea or light sensitivity. What you can do. 1. Stay hydrated and reduce caffeine intake. 2. Avoid excessive screen time and ensure proper sleep hygiene. 3. Seek medical help if symptoms are severe or persistent. 8. Numbness or tingling in limbs. If you experience numbness, tingling, or weakness in your arms or legs, it could be due to 1. Diabetes. High blood sugar can damage nerves. 2. Stroke. Sudden numbness, especially on one side, is a warning sign. 3. Nerve compression. A pinched nerve in your spine can cause tingling. 4. Multiple sclerosis, MS, a neurological disorder affecting movement. What you can do. 1. Pay attention to other symptoms that accompany numbness. 2. Maintain a healthy lifestyle to reduce the risk of nerve damage. 3. Seek immediate medical care if numbness is sudden or severe. Conclusion. Your body often gives you warning signs when something is wrong. Paying attention to unusual symptoms and seeking medical advice early can help prevent serious health problems. If you or a loved one experience any of these symptoms, don't ignore them. Your health is too important. Final tips. 1. Keep a health journal to track any persistent or unusual symptoms. 2. Don't hesitate to schedule regular checkups with your doctor. 3. Maintain a healthy lifestyle with a balanced diet, exercise and proper sleep. Stay healthy and listen to your body. When in doubt, always consult a doctor.